Greetings, everyone, and thank you for your participation and interest in what will be a very exciting and interesting panel discussion on frontline health workers, our lifeline. I'm super excited. My name is Madhu Deshmukh, and I'm the Vice President for CARE's programs on program strategies, impact, global program strategies and impact team. Very privileged to be with all of you today. As we enter into our second year of living with COVID 19, it has become painfully clear that no one is safe until everyone is safe. The safety of any one person depends on the global community's ability to protect every person. Some of us are blessed to be in countries that have begun vaccinating their populations, but we also have the issue of hoarding excessive vaccine inventory in some of these countries. And while these wealthy nations do that, new and devastatingly lethal variants of the virus continue to emerge in countries like South Africa and Brazil. If vaccinations don't effectively reach lower income countries now, the long term impact of COVID 19 will be catastrophic. It has already reversed several of the developmental goals. In fact, research from Northwestern University estimated that we can save twice as many lives if we invest in fair vaccine distribution than if we only focus on high income countries. In addition to saving lives, it's also profitable investment for the wealthy countries. According to Gavi and RAND Europe, for every $1 invested in vaccines in low and middle income countries, wealthy countries will see $4.80 of economic benefit because the economies can fully reopen sooner. Failing to invest in a truly global vaccine distribution strategy could cost wealthy economies nearly 4.5 trillion in economic losses. CARE's latest flagship report, Our Best Shot Women Frontline Health Workers Around the World Are Keeping You Safe from COVID 19. This report discusses how the current global debates about vaccine equality have largely ignored a major component of a successful global vaccination campaign. While much has been said about the vaccine access, policymakers have ignored the importance of investment in vaccine delivery and the rollout plans. No matter how many vaccines are globally available, investments in the actual delivery of the vaccines are the only way to control the pandemic by ensuring everyone gets vaccinated. CARE's Our Best Shot report shows us that the best way to ensure successful delivery is to invest in frontline health workers. Global vaccination is an urgent priority that will require 1.1 million full time health workers, 770,000 of whom will likely be women. Despite this urgent need, the work of these women largely goes unrecognized. In fact, half of women health workers' labor globally goes unpaid. Women face massive gender barriers and inequalities that make their roles and frontline health workers even more challenging. Our best shot exposes how women are at the forefront of service delivery, but not prioritized for vaccines and not at the decision making tables. To address the gap to support frontline health workers, CARE reviewed over 100 published studies about vaccine costs and used the World Health Organization's costing model for a 2016 Ebola vaccine strategy to calculate a more comprehensive picture of what an investment for an effective global vaccination campaign will actually require. In our Best Shot report, CARE estimates that policymakers need to invest $5 in rollout for every $1 that they spend on vaccines themselves. To deliver vaccines effectively, for every $1 of vaccine, governments, donor nations, and multilateral funders need to invest $2.50 to support health workers, including training, equipment, and salaries. This estimate includes fair pay and safe working conditions for both full-time health staff and part-time workers, as well as surge capacity for vaccinators. CARE found that many previous vaccine delivery models failed to account for healthcare worker payment in any capacity. Because of the particular crisis that COVID-19 has caused for women in terms of increased unpaid care responsibilities, this number also includes 15 cents for childcare costs to make it possible for the frontline health workers to function effectively. This also includes $1.70 to strengthening and maintaining health infrastructures such as cold chains, vaccine tracking systems, power supplies, and administrative costs. The needs for investment is also 65 cents for social mobilization and education campaigns to increase vaccine acceptance, as well as 15 cents to keep health workers safe from COVID, including the increased time it takes to administer vaccine campaigns while enforcing social distancing and higher needs for personal protective equipment. So with these as some of the highlights of CARE's report, I am very honored to discuss these findings further with two experts and CARE's trusted partners, David Bryden from the Frontline Health Worker Coalition and Angelique Lewis of Astellas Global Health Foundation. Welcome, David and Angela. Angelique. Sorry, apologies.
Good afternoon.
To introduce our two panelists, David Bryden is an advocate on global health issues based in the US. The Frontline Health Worker Coalition is comprised of 38 public and private US-based organizations, which urges greater and more strategic investment in frontline health workers in the low and middle income countries. David previously worked at Results Educational Fund, coordinating US advocacy on tuberculosis. In 2000, he co-founded the Global AIDS Alliance and served as its communication director. He holds a master's degree in international politics from American University and BA in philosophy from College of William and Mary. Thank you for joining us today, David.
Thanks very much.
Next, I'd like to introduce our second panelist, Angelique Lewis, who joins us from Astellas US, a pharmaceutical company dedicated to improving the health of people around the world through the provision of innovative and reliable pharmaceutical products, including vaccines. She is also the vice president of the Astellas Global Health Foundation, an international philanthropic organization dedicated to improving access to health in underserved global communities in an effort to make a sustainable impact on the health of people around the world. Angelique is responsible for leading Astellas US corporate social responsibility programs, including the strategic management of Astellas Global Health Foundation. In response to COVID-19 and inequity challenges, Angelique quickly built corporate and foundation programs totaling more than $2.5 million to engage employees and impact communities around the world. Welcome to the panel, Angelique.
Thank you, Madhu. So happy to be here.
Thank you. Really excited to hear your views and insights. So, David, let me start with you. What are the main issues that you have seen frontline health workers facing in the context in which you work?
Thanks very much. I'm really excited about CARE's report and the really powerful recommendations that it includes. So I really hope everyone takes an opportunity to read through the report in detail. Our supporters around the world, when it comes to frontline health workers, what we're hearing from them consistently is that they've been going through a crisis. Over the last year and a half, it's been unprecedented. The pressures on them when it comes to the workload, the stress leading to really serious mental health concerns in many countries, uh, terrible working conditions when it comes to basic safety on the job, when it comes to access to protective equipment, but also basics like water and sanitation in the clinics. Lack of leadership opportunities, particularly impacting women and their voice not being taken seriously. So I think that there's a whole range of issues that we're hearing from the frontline health workers across the world, and we've got to take them on. We heard, for instance, just to take a few examples, Zipporah Iregi, a nurse in Kenya, told us about the strike that workers have had to engage in that country that went on for several months. And that is just one example. There have been strikes in 84 countries by health workers all around the world. A midwife in Nigeria, Ola Adebayo, told us about the irregular payment that midwives are receiving, but also the lack of protective equipment. We've been hearing from frontline health workers about the crisis they're going through, and this cannot be sustained.
Couldn't agree with you more on the challenges that are being faced by the frontline health workers. Next question is for both of you, but let me start with you, Angelique. We know that health workers need to be supported by strong health systems, especially within the context of COVID-19 and in preparation for future pandemics. What investments, in addition to health workforce, need to be made to ensure our health systems are prepared to respond to global health emergencies?
Thank you, Madhu. To best leverage our experiences during the COVID-19 pandemic and come out better prepared for future pandemics, we must embed greater resiliency in our health systems. As part of my role in managing the Astellas Global Health Foundation, we focus on funding initiatives which enhance physical facilities, data and information systems, as well as support the healthcare workforce to enable access to preventative, diagnostic, and curative care in underserved communities. This includes training women as community health workers, given their critical role in building trust, delivering care and services, and connecting communities. With these efforts, we hope to help support some of the most vulnerable communities in low and middle income countries, which are often most at risk following any catastrophic situation. We encourage other funders to support healthcare infrastructure to ensure health systems can handle a future pandemic.
Thank you, Angelique. So important for focusing on the health infrastructure, and especially, as you mentioned, looking at building capacities of frontline health workers and the trust building. Thank you for that. David, would be curious to hear your thoughts on that question.
Yeah, the approach to COVID-19, as you look into the future, if we carry on the way we're going now, it just simply is not going to work. And the reason for that is that it requires a massive scale up on a scale we've never seen in terms of the number of people that we need to reach. How are we going to do that? We're going to need to go beyond investments in the workforce per se to the broader system that is needed to really consistently deliver high quality care in primary care settings, and really get universal coverage to access to healthcare, take healthcare as the right that it actually is, and make sure that that there are functioning health systems that the health workforce can flourish in and have productive careers in. That's the only way we're actually in the long run going to defeat challenges like COVID-19, because if you realize it's not just a one-shot injection of this vaccine, this could be an annual thing. And that really is at a scale that we've never really attempted before. That's going to require functioning health systems. That includes everything from ventilation in health facilities to water and sanitation, but also the supports that workers need in order to get through their day: break rooms, childcare, safe transportation. So these are the things that really the United States needs to take on if we're going to be serious about global health security.
Absolutely. Thank you, David. We definitely need those investments to build the flourishing health systems in order to scale the COVID-19 vaccines and COVID-19 prevention efforts. Thank you for that. Angelique, let me turn to you to ask you a two-part question. I'll start with the first one. So the Astellas Global Health Foundation invests in training women as community health workers. Why is it important to make that distinction? And if you've seen any unique challenges specific to the women frontline health workers that they are facing, if you could share your thoughts on that, please.
Of course, thank you. A number of the grants the Astellas Global Health Foundation has made to date have supported community health workers, as they are trusted members of the community that serve as a bridge between communities, health systems, and the health department. As the Care Our Best Shot report outlines, women health workers are putting themselves at risk every day, yet they continue to strive to make a difference for the members of their communities, as they feel it is their duty and obligation to their families and their communities. Investing in community health workers can help address the various factors and conditions that lead to poor health and that disproportionately affect low and middle income populations, which are often magnified during times of crisis.
Thank you, Angelique. And any preliminary results that you have seen from investing in frontline healthcare workers in Ethiopia and South Sudan with CARE?
Of course. To date, we have seen such tremendous results across the board as part of the programs the Astellas Global Health Foundation has funded in Central America and Africa, particularly in light of the global pandemic, which started as we entered our second year of funding as a global foundation. We are proud of the impact our partners are having on the communities they serve. Specific to our grant to CARE, we are thrilled with the tremendous early results the team has reported, including in Ethiopia. The project has supported mass awareness raising and risk communication via community engagement over a period of 3 months, reaching nearly 145,000 people. And in South Sudan, the project has trained more than 250 health workers on standard precautions and infection prevention and control for respiratory diseases using standard materials from the National COVID-19 Steering Committee. As a result of the appropriate training and infrastructure, frontline healthcare workers were better prepared to safely provide COVID-19 screening and health education to the communities that trust and rely on them, and ultimately increase the resilience of health systems and communities. In areas where committed health personnel are available, communities are more aware of COVID-19 and take more precautions compared to other areas. And in addition to training, the foundation investment provided appropriate PPE and infrastructure like hand washing stations and a latrine.
Thank you, Angelique, and thank you for your partnership and support to CARE for this really important work and some really encouraging results and impact that we have seen. So thank you for also being an advocate with other donors.
Thank you.
My next question is again to both of you, but David, let me start with you. We know that prior to COVID-19, there was a projected global shortage of 18 million health workers by 2030. COVID has, of course, had detrimental effects on the well-being and retention of many of our health workers, as you mentioned in your remarks earlier. What do you think governments need to do in order to ensure more human resources for health? And what role can gender equitable policies play in the recruitment of healthcare workers?
When it comes to health workers and the shortages, it's something that we in the United States are dealing with here. We don't provide the adequate conditions here for our health workers, and so it shouldn't be any surprise to us. There are some countries in Africa and other regions that have really been leading in this area. You can look at Rwanda and others, but I do think that we're looking at a severe system-wide weakness in many countries. And if you ask a health worker, do you want to work in a broken system? They'll tell you no. If you ask a nurse who's graduating from nursing school in Kenya, do you want to work in a system where you have unreliable supplies, where your voice might not really be taken seriously? You don't have a seat at the leadership table when it comes to coming up with policies that reflect your needs in your hospital or your clinic, and where you can't rely on water and sanitation and supplies in your clinic, where your pay may be irregular or not provided at all. Some healthcare workers, as you were saying, and it's documented in your report, are not adequately paid at all or are poorly compensated. So that's a system that is broken. That's a system that really cries out for change. And I think that unless we address those issues, we're going to continue to have a shortage of health workers. Health workers are going to leave and work in other countries where they can get regular payment and their families can thrive. And for countries to really address those issues, it is first and foremost their responsibility. But I do think that the United States can play a critical role in catalyzing progress, in helping to open up fiscal space for governments to really hire the health workers that they need, using support from the World Bank or from other sources, and address inequities in their own country to really invest in the health system. We really need to see it as an investment. It's not a cost. It's actually an investment when you look at the economics of it, particularly when you're talking about investing in women health workers.
Thank you, David. I couldn't agree with you more that we have to look at it as an investment and not a cost, especially as we look at providing a fully flourishing healthcare systems that includes the remuneration and payments to the healthcare workforce and addressing inequities. Thank you for that. Angelique, I would be really curious and interested to hear your thoughts on that question as well.
Thank you, Madhu. As the CARE report states, investing in women community health workers is one of the best ways to ensure we experience the benefits of COVID-19 vaccines and the future of the health workforce. It needs to be a collaborative effort with support from local governments, international relief and humanitarian organizations, industry, foundations, and more. We all have a role to play in supporting healthcare workers around the world who are giving so much to help all of us make it through the pandemic and beyond. For our part, the Astellas Global Health Foundation will continue to focus on helping the most vulnerable populations. We're actively investing in initiatives and collaborating with organizations who are working on the ground to support healthcare workers and improve infrastructure in low and middle income countries. This collaboration also gives us an opportunity to work with our partners and make sure gender equitable practices are factored into the development of programs and initiatives from the onset.
Thank you. Thank you, Angelique. And again, thank you for reiterating that we need to ensure that gender equity policies are front and center to our response, especially as we work with frontline health workers. David, I'd like to turn to you for the next question. CARE's report estimates that to conduct a comprehensive strategy in this global level of global pandemic, policymakers need to invest $5 in rollout for every $1 that they spend on vaccines itself. As the coalition, especially advocates of the US government, on behalf of the health workforce and the issues. What role do you see the US government specifically playing to support the investment in frontline health workers in the global rollout of the vaccines?
Yeah, I think that's a really important question, and your calculation is really compelling. I think we need to take that to our policymakers and make sure that they understand how serious this is. Really, if you're based in the United States in particular, your first job is to make sure that your representatives in Congress know that this is what we really need to see happen. It's not just the vaccines. That's really important, obviously. You need the vaccines to inject, but then you need these support services to make sure that the vaccines actually get injected. And it's something that we're very worried about. Vaccines can be provided to countries and then they expire before they're actually injected. That is a serious concern in a number of countries. What can the United States do? The United States can do a lot to really help countries get these vaccines delivered at, in villages all over the countries. And that's really critical. It's got to get to the community level, not just in the big urban centers, but really to the community level, even in rural areas. That's absolutely crucial. We've got to share the vaccines that we have, and that's really crucial for the Biden administration to take on, make sure that there are the vaccines to inject, but then also the delivery services. One thing to note is that most people in the US are familiar with the big COVID relief package that Congress finally passed, 1.9 trillion. There is a segment of that, actually about 11 billion, that was reserved for health countries actually address the COVID-19 epidemic in their countries. And that's money that the United States should use to the fullest to really make sure that countries injected in people's arms. So the USAID has a lot of flexibility in terms of how those funds can be used. And I would say that when we look at the budget puts forward a budget proposal, and then when it comes to funding, the Congress should put in significant funding to make sure that the resources are there to not just receive the vaccines at the airport, but actually deliver those vaccines, inject those vaccines, because it's not going to do anyone any good if the vaccines are not actually used. So that's, I think, really crucial. And the United States puts a lot of funding in through specific disease interventions, HIV, TB, malaria, and specific issue sectors. Really, what we need to be doing is investing in a cross-cutting way that strengthens health systems and really delivers cross-cutting support to the health workforce, including the community health workers. So that's why we're proposing $100 million in the fiscal 22 budget to really address that need for cross-cutting investments through USAID to really get the funds needed to strengthen the system. Because this is not just going to be a one-shot deal. This is going to be an annual effort in adult vaccination of a scale that we've never actually seen before. So that's going to be absolutely crucial. And lastly, I would say the United States supports the Global Fund. That's a really important mechanism, but we need to make sure that the United States is watching closely how those funds are being used. Let's make sure they're used to the fullest to strengthen health systems.
Thank you. Thank you, David. Really important for us to advocate with our US policymakers and for them to demonstrate their commitment to investing in the rollout plans and especially investment in the frontline health workers as we think of COVID-19 response, especially the rollout of fair and equitable COVID-19 vaccines. So with that, thank you so much, David and Angelique, for your comments, for being on this panel, and most importantly, for your commitment, work, and insights to invest, support, empower, equip, and protect the healthcare workers who are absolutely critical to a successful rollout of fair and equitable COVID-19 vaccines, as well as to achieve the goal of health for all. So thank you to both of you.
Thank you.
Thank you.
we will now open up the floor for questions from the audience. And looking at, so I see there's a first audience question, which is there any particular reason the reference to community health workers is in reference to women and not men? David or Angelique, would you want to take that question? To me, I think in the CARES report, we had said that although we are looking at healthcare workforce and health workers, overall, nearly 77% of the healthcare workforce are women. And also the fact that women healthcare workers face the gender inequitable practices and therefore the power dynamics. So to me, that's a reason for us to focus on the women community health workers, but definitely not to the exclusion of the community health workers who are men. But would appreciate any thoughts from David or Angelique.
Yeah, I think that you're absolutely right, Madhu. When it comes to the proportion of community health workers who are women, we're talking about the vast majority. And when it comes to their participation in the workforce, that's absolutely crucial. They have many burdens, when it comes to family responsibilities, and so that means that they really need to make sure that they get support as they're involved in this as community health workers, and not only payment and professionalization and regular salaries, but also the mentoring and supportive supervision they need to do the job. And so there's a whole set of needs that they really need to be addressed. And countries have a big opportunity. By using community health workers, they can reach people down to the village level and really go reach people where they're at. So that's absolutely crucial. But when it comes to the inequities that are faced by women in the health workforce, we've got to take those seriously. There's a lack of respect. There's a lack of opportunity for advancement. There's a lack of representation in leadership bodies. And that's a broader phenomenon when it comes to gender inequities as we look at the health workforce in many countries.
Thank you. There's a question from Ina Kafunda. Is there any particular reason the reference to see it? Oh, sorry, I think we've already taken care of this one. So this one is from Saurabh. And the question is, in my opinion, people here in India are still reluctant to get vaccinated due to the fear of side effects from the vaccine. So how can we make them aware about getting vaccinated and getting over the fear of side effects? Great question, Saurav, and definitely all of us globally are dealing with vaccine hesitancy as a very key issue to ensure that people get to the places and where vaccines are being administered. And I think there is a specific role one can play, one could look at with the trust building piece. And I think, Angelique, you had referred to the trust building piece, and which is so critical in order to make sure that we address the vaccine hesitancy by providing people the right information, but also building their trust in the systems, especially the frontline health workers that are administering the vaccines. Would you like to sort of take this question, Angelique?
Sure. Of course, thank you. And you are correct. It's the community health workers that are the most trusted in the communities. And they are often those that are providing education and outreach and helping demystify vaccines and the side effects. And so it's proper education down into the rural communities where it's needed most.
Thank you. David, did you have anything to add to that?
I support that 100%. I think if you look at the community health workers, They're an enormous asset when it comes to community education, overcoming these kinds of myths and concerns, really explaining to people why the vaccine is in their interest, and what the side effects, how to think about the side effects if they're experiencing any. So it's I think a really critical role that they can play, but I think it's going to take a real investment, because we can't just simply assume that the community health workers are there. They're going to be injecting vaccines, they're going to be educating and doing all the other things that we expect them to do when it comes to distributing bed nets or other essential health services. So we need a reality check in terms of their capacity, and the world needs to invest in them so that they can rise to this challenge.
Thank you, David. Can we go to the next question? All right. So, what kind of work do frontline health workers do? Why are they so vital for vaccine delivery? Absolutely critical and critical question central to the discussions that we had today. David, may I turn to you to speak to that or respond to that question based on the remarks you already made?
Sure.
Thank you.
Yeah, we've seen the news about vaccines arriving in Ghana, vaccines arriving in Cote d'Ivoire. We've seen those positive headlines. Those are boxes of vaccines arriving at an airport. What happens next? That's really where the frontline health workers come in. They need to be staffing the clinics and going out and doing the community outreach as community health workers to actually educate people about those vaccines, why they're important, why they're necessary, and demystify the process, explain the process, but then also to actually inject those vaccines safely. And it's a longer endeavor than one might think. It's not just an assembly line of injection, 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 injection. Each injection is about 20 minutes at a minimum. And so given all the education that's required and preparation. So it actually requires frontline health workers in sufficient numbers to do that, but also to take care of all the other health systems needs, whether it's delivering bed nets, providing HIV medications, delivering babies. There's many things that we need the frontline health workers to do. And now we're asking them to take on this additional, very large burden of vaccinating the world. So we're going to need to support them to do that.
Thank you, David. And great questions from the audience. I think we really need to keep advocating, promoting, bringing evidence-based information to ensure that the governments and the donors are investing adequately, appropriately to support the frontline health workers as part of the overall health system strengthening agenda. So thank you so much, David and Angelique, for all your work to empower, support, and protect the frontline health workers, who are really the ones who make it possible for us to be healthy and will be critical to ending this pandemic. And thank you all. Sorry, I see there is another question. How can private citizens help frontline health workers? I don't know if we have the time, but David, do you want a quick 1-minute response to that?
Yeah, absolutely. I think that we really need to reach out to our elected officials and make sure that they know that we believe that we need a global response to this crisis. Whether you're living in the United States, whether you're living in the UK, wherever you are, reach out to your political leaders, reach out to your parliamentarians, reach out to your members of Congress, make sure that they know that as far as you're concerned, the response to COVID-19 needs to be global, needs to be based on solidarity, needs to be based on equity. That means sharing the vaccines. That means ensuring that the vaccines actually get injected. And it means providing the support to the workforce so that they get the fair compensation that they deserve and the respect on the job that they need to actually carry out this mammoth task. Your job, first and foremost, if you care about this agenda, is to contact your elected representatives and let them know where you stand.
Absolutely. Thank you, David. And so important for all of us to be involved in supporting and promoting the work of the frontline health workers. So with that, in the interest of time, want to reiterate my thanks to both David and Angelique for the work and for participating on the panel today. And thanks to our audience for joining this discussion. And please do read the CARE's new flagship report if you have not already done so. It's our best shot how women frontline health workers are keeping you safe from COVID-19. With that, just want to say a huge thank you to everyone and look forward to continuing with the good work to support the frontline health workers. Thank you, everyone.
Thank you.
Thank you.